It's my privilege and honor to be here with these wonderful scientists and physicians to open this panel to discuss the COVID-19 vaccinations, what has happened, where we're going, and where the future is. The first speaker is going to be Dr. Richard Urso. He's inventor of the FDA-approved wound healing drug. With 11-year experience in lab work, he has treated 2,400 patients and is a co-founder of Global COVID Summit. After Richard, we're going to have Jessica Rose, Canadian researcher with bachelor's in applied mathematics and master's degree in immunology. Pierre Kory is a former chief of critical care and medical director of trauma and life support center of University of Wisconsin. Dr. Jose Augusto Nasser is Brazilian neurologist, professor at Columbia University in New York, member of Médico Pela Vidas, PANDA, and Luc Montagnier Foundation. And our last speaker will join us a little bit later by Zoom, Dr. Paul Alexander, Canadian researcher with degree in epidemiology and doctorate in health research, methods, evidence, and impact. And we're going to start, thank you. We're going to start our discussion with Dr. Richard Urso from the United States.
Thank you, Kat. We heard some great lectures this morning. It was really terrific. Thank you for World Council for Health for putting together such a wonderful event. It's really important that we have these collaborative events where we get everybody's input and how we can move forward. And it almost shocks me to think about how things started out. I still go back to those early months in 2020 where there's the novel coronavirus, and I couldn't understand why they kept calling it novel. It just seemed such a weird term. But now I understand it as goes along with man-made climate change and the unprovoked war with Ukraine. There has to be some way to sort of message, and I think overall this is what we've seen. They're very, very good. The other side's very good at messaging. So we'll talk a little bit more here today about the novel coronavirus. And I'm not sure where I'm supposed to point this, but maybe a battery change. But anyway, until I get these slides going. So I think messaging is a big important thing because they've learned to keep us from liking each other, right? So great quote from Malcolm X, if you're not careful, you'll be hating the people who are actually being oppressed and loving the people who are doing the oppressing. And that's what we're seeing, right? If you're unvaccinated, you're a bad person. And we don't want to reverse that though. We don't want to say, hey, you're vaccinated, you're throwing off exosomes, please don't get in the room with me, even though that's true. Okay. And as I said, again, the messaging is wonderful. It's basically the same message over and over, and you'll see it on Twitter where people are just keep putting out the same information. Hey, it's a good thing I had that triple vaccination, or who knows how sick I might have been. And I think this is the elected leader of the world. Is this who we have here? Anybody vote for this person to lead the world? No, I didn't either. So, but this is kind of who's orchestrating this. And you think about that, the way they were able to accomplish what they accomplished is they've got their fingers everywhere. The prime minister and the cabinets of almost every government in the world have been through his school, the Young Global Leaders. And I think for people who don't know, and I think most of the people in this room do, this is how they've been so capable, right? They have leadership that has been created, and they put people into powerful positions that coordinated all the efforts that went behind this pandemic. They have good funding sources. Another fine European who has basically, been a very powerful factor in the United States and NGOs. And I recently heard in my office, I had my auditors in. We have a big office. I have 700 employees, and he was in telling me how we needed to get with all the new ways of messaging. he, her, him, or whatever we're supposed to do. And he said that, I think the words were that these were grassroots efforts. So these grassroots efforts are funded with multiple millions of dollars through a person like this. So it's very important that we let people know this are not grassroots efforts. These are efforts that are funded. If you want to go and be paid, you can come to the United States and be a paid protester, and this man will probably help you get paid for that. This is not going to stop with COVID. We are going to have the movement towards cricket food, plant-based meat. This is all going to be, as you know, the Netherlands, which puts out a tremendous amount of raised beef, has been told they need to keep the planet from changing its environment because they just decided that that's how we're going to control the food supply is the next thing they're going to go after. So I want to get to what we're talking about here. You heard Dr. Bhakdi talk about this today, and this is so critical. The lipid nanoparticle messenger RNA platform is horrible. It doesn't matter what it is, it's horrible. It cannot be controlled. There are people here, including myself, who work with lipid nanoparticles. We were using chemotherapy to carry chemo to the brain. It's pretty good at getting to the brain. Unfortunately, we were wiping out the bone marrow, the adrenals, the ovaries, and other organs. And so we decided this is not a good strategy. And so it's basically one of the major reasons why any lipid nanoparticle platform with a foreign protein is going to be a problem. Because this foreign protein is going to be in places a respiratory virus doesn't go. In this case, the respiratory viruses go in your brain, your bone marrow, your adrenals, your ovaries. No, they don't. It's not what they do. Does less than 1% get into those tissues? Probably, but it's a very small amount. But the vaccine gets there in fairly large amounts, and this is a bad, bad strategy as we move forward. And then you see that the wonderful thing they did with this product was trying to get it to be to get into cells and be undetected by the immune system. And that's the pseudouridine component. And that has made the attainment of being able to say how much is each person being producing. We don't know. You may be producing 100 times more than I'm producing. So we have a biodistribution of everywhere. We have a pharmacokinetics where we don't know how much you're making, and we're saying it's safe and effective. How is that possible? Actually makes no sense. There's no way. I don't mind saying it. There's no way they're going to ever make a product that's safe and effective when you can't control the distribution and you can't control the production. And until they get to that, they should never go forward with any of these products, if you can't even do that. And then what did they... I'm gonna say, actually, if that's all you remember from this talk, that's the most important part. Honestly, that's the most important part. Now, where else did they screw up here, right? So they took the spike protein and they put things on it that block DNA damage repair, P53 and BRCA. Toll-like receptors 4, 7, and 8 are disturbed. It reverse transcribes easily in tissue culture. It's interferon suppression, which is super important in cancer and viruses. It's shedding. This is normal. It could be used for good. If we were going to do, let's say we're doing animals and we want to vaccinate, some of the animals and know that they're going to carry the rest of it back to the nest. It could be used for good. But in general, to say it doesn't exist is an absolute absurdity. It is what it is. It does that. That's what these things do. And I want to go through a few stats. In the United States, 40% more deaths from 2021, 84% more deaths in the last quarter in 25 to 44. And I left a few things off, but they also had this bind ACE2, TMPRSS2, the NRP1. You also see that there's this this GP120 fragment that's creating the prions. And one of our other speakers will talk about that today, so I won't talk about that anymore. But prions cause, of course, mad cow disease. We talked about this, COVID. It's killed science, logic, and medicine. What's our latest one? I thought this was funny. I actually made our national news somehow. I don't know. Somebody saw something I put on Twitter and put this on the national news. This doctor said that it was unreasonable to only test it on 8 mice. Does anybody agree with that? That that's reasonable? So it's almost laughable, right? So 8 mice, all of whom contracted the virus. So is anybody aware of that? Actually, we all contracted the virus, okay? I don't know if they went to the mouse hospital or not. I'm still trying to get the data on that, but I almost have to laugh, sorry. But that's what they're doing now. So we're doing things we've never done in science before. We're not testing them. And that's where they've got you now. It's like, hey, messenger RNA, lipid nanoparticle, it's safe and effective, we proved it. No, you didn't. You did not. It's not safe and effective, it's dangerous, it's going in a place you don't need it to go. You need to stop it. This is not right. So this is where we've gotten in the United States. They don't even do human testing anymore because it's so safe and effective. And there's a bunch of studies they've done where they retracted. They did the fake Lancet study on hydroxychloroquine, and we have times where Pierre's done the best job on this, talking about how badly they've evaluated ivermectin. And I always say we know they're lying. They know they're lying. They know we know they're lying. We know they're still lying. We know they're lying, but they're still lying. So I think we're never gonna beat them at that game. They're more conniving, they're more deceptive than we are, right? That's what they do. So I wanna just say, the worst part about it is they actually are trying to make you think that they're smart. They're not smart. They're cunning and deceptive and deceitful, right? They didn't invent a single thing. This group that I showed you at the beginning, the world leaders, nothing. They invented zero. Scientists invented the technology. And what I would usually like to say is they saw scientists making nuclear energy, and instead of making electricity, they made bombs. They upgraded these viruses. You just saw all the stuff I listed. They upgraded these viruses. Who cares if it was accidental or not? You should have never been doing this in any fashion. You should not have been making nuclear bombs. At that point, if you did it on purpose or not, it doesn't matter. I think I like this audience, thank you. And they're actually putting out the same garbage. They said the vaccine, they do mathematical modeling studies. I don't know who the mathematicians are. I think these are in grade school. But they found that the vaccine saved about 2 or 3 million people. This is not true. Who's it funded by? Funded by the usual suspects, okay? Gavi, et cetera, Bill Gates. What did Peter Doshi found? I don't know why Peter Doshi is doing what he's doing. I consider him to be amazing that he's able to put together some of this work that he's done and some of the other people with him. But he basically found that the vaccine, those original trials, for people who don't know, right? Those original trials, they actually had more adverse events, 187% more adverse events in the vaccinated that ended up in the hospital. Did you guys all know, do you guys know that data? A lot of you guys know that. And there was more deaths, I think it was like 22 to 13. So even in the original trials, they were failures. They didn't help with death, they didn't help with hospitalization. In fact, it was the other way around. I don't think I have much more time, so I'm gonna kind of zip a little bit. In England, I think you can look at the death rates in children and the triple vaxxed, and you can see, or the double vax, that it's such a harm. We don't have real good data in the United States. They've hid the data from us, right? So they stopped tracking in May of 2021. But in England, we were getting good data until mid-year. And we were seeing that it's almost, I think, 134% more deaths in the vaccinated kids, 10 to 14, than the unvaccinated. That's all-cause mortality. This is, it should break everyone's heart. I'm sure it does here, but it's amazing. Again, the messaging, they're so good at hiding this. most people wouldn't have any idea that this actually happened. Again, triple vaccinated do the worst in England, once again. And so, you know, one of the things we say, it provides immunity, but only for the manufacturer. And you see, you all heard what's happening on the soccer pitch. All these athletes are dying, okay? And we have reasons. They have figured it out. It's not from the COVID virus. I mean, it's not from the vaccine. It's from COVID. Or maybe referee whistles, okay? And I love this one. They have multiple things. Heart attacks, skipping breakfast cause the heart attack. This one, I love the one on winter vagina, whatever that is. And men can get winter vagina, by the way. In case you didn't know. Breathing too many times a day could cause a deadly heart attack. We all know that. Stress. So the misinformation is constant. So I just want to quickly, I'll run down this real quick. Pharmacokinetics everywhere, especially ovaries, could have caused fertility problems. Well, let's go to men. The semen counts are lower, right? And they supposedly recover after one of these, but after 5, who knows? We have data from countries that have reported. They said, the fact checker said when we talked about this last year, I was called an anti-vaxxer, one of the top 10 in the United States, that it was not affecting fertility. All I said at the time was, a lot of it's going into the ovaries, so it's going to cause inflammation because that's what the product's designed to do, and it certainly might affect fertility. That was my statement. And we're seeing, you know, this basically 10% reduction in fertility this first quarter in much of the countries in Europe that are reporting. Do lipid nanoparticles go across the blood-brain barrier? This has been well known. I just pulled this study. There's multiple studies. We all know that's what they do. They're really good at this, and so there's no surprise here. We're seeing increase in cerebral venous thromboses. And this is basically showing, I think, one of the earlier speakers talked about this. The lipid nanoparticle itself is inflammatory. This is well known, and that's one of the reasons of the danger of the product. It's not just the foreign protein, which is inflammatory, but the lipid nanoparticle itself is very inflammatory. You don't need the lipid nanoparticle. The lipid nanoparticle alone can cause a lot of problems. So it's a very dangerous product because you're creating a foreign protein, but you're also wrapping it with a fake lipid nanoparticle. And there's a lot of things that it goes through that basically show it acts in itself as an adjuvant. I think this is one of the most important studies because it addresses several things. And I think, you know, in this study they found that the production was going on for 60 days or more. They stopped the study in a lot of patients. And this is such an important study. It also highlights something we call immune imprinting, which in a sense, if you start attacking this virus, this one protein, Wuhan 2020, basically you get blinders. You've got all your immune system focused in one place. And so you can't fight things here and here because you've got your natural killer cells, your cytotoxic T cells, your complement cascade, your antibody production, everything going, because you give 1 shot, 2 shots, 3, your immune system's smart. It ramps up first, second, third, fourth gear. It basically makes an adjustment over and over. And so I think Dr. Vanden Bosch is here, and he's the best at describing all this, and he's influenced a lot of our thinking. But I look forward to hearing his talk today about this immune imprinting and all these things on the virus itself that are creating a lot of the problems that will probably never win unless we take a different strategic approach.
Richard.
Done? Okay. So that basically kind of wraps up. Ryan Cole hit this. Yeah, I've got a few more. Yeah.
So Richard always puts a lot of slides together, and we usually have to have talk a little faster.
I already covered all the stuff, actually. And I think, in the end, we're going to see nature wins, God wins, we're going to win. Thank you so much.
Is this thing on? Go ahead. Sorry, I'm really tired. Thanks to all the organizers, the people behind the scenes that sometimes don't get enough credit. I know how hard you guys work, so man, kudos to you. Kudos to you guys. Oh, a little closer, okay. Kudos to you guys for being here. I hope I don't forget anything because this is the first time I'm live and in person, so bear with me here. Oh, and thanks. This isn't a cheerful talk, so I'm glad that Richard was cracking some jokes because this one's not funny. So it's basically going to be a literature review, some of the most important papers coming out that relate to fertility issues in the context of these injections, along with some VAERS data. So this is the topic, the focus on fertility, some data, and what the studies are showing us. Does this go? Where do I point this? Oh, okay. So just as a reminder, and I think this is really important, we're still in an experiment right now. You guys are probably all aware of this. The phase 3 clinical trial of the Pfizer product was, it was only 6 months long. It was lamentable to describe it in positive terms. It's still ongoing. The end date is anticipated to be 2024. This probably has a lot to do with them continually reducing the age groups. And interestingly, I found out when you look up this clinical trial number, you'll find out that they're not sharing individual patient data anymore. It's just crossed out. I thought that was kind of weird and interesting that people know that. I'm not a clinical trial person, but that seems kind of suspicious to me. We have Dr. James Thorpe, who's recently done a study of VAERS data, and he requested that I do a confirmatory analysis of his findings, which I was able to do. And he found abnormal bleeding in women. He also found many fetal disorders, as you can see in this chart on the right, up to 1,000-fold greater increase when compared to the past. So the Epoch Times wrote this up. Am I in your way here? The Epoch Times wrote this up, and I was quoted to have said this in the context of a recent VRBPAC meeting for the pre-EUA granting of these products into 0 to 4-year-olds, and I stand by my words. Safety data looks pretty bad. As everybody knows probably, but just to remind you again, the biodistribution reports from a FOIA-requested study from Japan, thank you Byron Bridle, showed that not only do these lipid nanoparticles biodistribute, but they bioaccumulate in such places as the ovaries. And that is bad news. And they stopped actually measuring the concentration levels of the lipid nanoparticles at hour 48 when they terminated the animals. So you'll notice that the curve is exponentially increasing. So if you just project that into hour 120, for example, this isn't real. This is just an idea to give everyone that we don't know to what levels, what concentration these lipid nanoparticles continue to accumulate to. So it's something really that needs to be investigated. This is not something that they didn't know about, which is one of the malfeasant issues that I have with this. This is a study that was published in the Journal of Controlled Release, 2012, so that's 10 good years ago. And they did a study using the exact same animals, Wistar rats and mice, and it showed that not only the nanoparticles that they investigated accumulate, but they accumulate in the ovaries. So it's not like they didn't know. This paper came up, it's really important for everyone, thank you, to know about.
This is another point that we were told that reverse transcription was not going to be possible for these modified mRNA products. In fact, it is possible, and it has been shown to happen in a human liver cell line. And the problem I have with this in the context of fertility is that the endogenous reverse transcriptase that is used in order for this to occur is something called line 1, which is endogenous to humans, and it's implicated in embryogenesis. So the fast uptake of the Pfizer product was shown in human liver cells, like I said, and that leads to changes in expression levels of this line 1, reverse transcriptase. This is a chart from a paper that was published in Nature Genetics in 2017, which clearly shows that the line 1 expression level has to be at a certain amount as per the stages of embryogenesis. And if it's not at a certain amount, then you're going to have problems with developmental arrest. So this is something that really needs to be looked into with regard to these products. As most of you probably know, I do look at VAERS data. I see this kind of as the leaves rustling in the wind as evidence. And in the context of fertility, we can approach this from the pregnancy point of view, or we can look pre-pregnancy at the menstrual cycle. So I'm just going to show a little bit about the abnormal menstrual bleeding that's been reported in VAERS and also in published papers. So this is a chart that shows the VAERS data for abnormal bleeding, menstrual disorders as of September 9th. It's normalized to CDC data that's age stratified. And you'll notice that the N, which is the absolute count, is approximately 43,000. You can see some of the example keywords at the bottom that I used to extract this data. And the 25 to 39-year-olds, surprise, surprise, have the highest rates at 48 per 100,000. But I want to point out that this is not including the underreporting factor. So if you consider my modest estimate of what the underreporting factor for a severe adverse event might be, which is 31, then you get a rate of 1 in 67 women who are experiencing these problems, which it doesn't sound unrealistic when I'm listening to the ground, or I have my ear to the ground to what the women are actually saying. When you compare this to the past 5 years of VAERS data, this is normalized per total number of adverse event reports per year. The past 5 years for all vaccines combined. So it's even more staggering because in 2021, 2022, it's only for 3 products, the Moderna, the Pfizer, and the Janssen. So you can see here that, you don't need statistics, it's not comparable. The mean over the past 5 years for the menstrual disorders, these are the exact same measure codes that I pulled out, is 175 compared to 5,033. This slide I wanted to keep in because can I swear? Yes? The amount of bullshit online when you go in search of information now, you guys, I don't know if you're looking, but it's staggering. This one popped up. This was written by a woman in March 25th, 2021, which is a long time ago. And she definitively states that the products, the mRNA products, will not induce any fertility issues. And it's just, I don't know I was trying to think of the word to describe what saying that makes me feel, because it's beyond malfeasance. There's no way for anyone to make that statement because we have no long or short-term safety data in the context of fertility or pregnancy. So I think that's quite shameful, to say the least. Yet another piece of evidence, a paper was published in Cells in 2022 that showed that human ovarian cells are infectable by SARS via the spike ACE2 mechanism. So, with the spike being the template that is the template encoding the spike protein, this also raises some very valuable questions that need to be answered here. This is another paper that was published in Science Advances in 2022 in July. It shows menstrual bleeding changes after SARS injection. So this is in the context of the injectable products. And you'll see that it's about half of the women did report regular menstrual cycles whereby it was heavier. I'm sorry, they reported heavier bleeding. Breakthrough bleeding was observed in 71%, which is a lot. on contraceptives, and 66% of postmenopausal women started bleeding again. So not only do we have these increases in rates, we have increases in weird stuff happening that shouldn't be. I won't spend too much time on this, but it's very concerning. This is a paper that showed molecular mimicry, which they actually mapped 27 human proteins, pentapeptides, which are just sequences of 5 amino acids that were linked to oogenesis, placentation, and decidulization. And this is very concerning in terms of an autoimmune reaction in the context of the female reproductive system. Again, in the context of the injectable product of Pfizer, menstrual cycle symptoms in healthy women were reported to be increased, menstrual changes, heavier bleeding, etc. And interestingly here, this is just a point of interest, I didn't draw any conclusions. The women who reported menstrual changes there was a really statistically significantly high association between that, the irregularity, and the women on medications. And one of those medications, regular medications, one of them were SSRIs. And I don't know if anyone knows this, but recently it was found out that SSRIs aren't really doing what we thought they were doing. So again, it's another point of interest that I think warrants investigation. Another study was published, the one on the right here, by a group reporting on VAERS adverse events in the context of pregnant women from December 2020 to October 2021. Another group published a brief review saying, yay, we agree. And then another group came along and did an editorial and said, we don't agree. So I agree with the ones that don't agree. They concluded this. And this is one of the tables from that paper. And it's not the most important thing I want to point out here. Their VAERS numbers weren't what I calculated them to be, but I'm not going to split hairs about that because VAERS is inherently weird. But this one is important. Now, what I did was I pulled out all of the women that had reported an exposure to a vaccine, as in the past 5 years, or to these products, the mRNA products, in 2020, the same time frame, 2020 December to October 2021. And then I took the number of women who reported having a spontaneous abortion of that subset. So in the past 5 years, the rate of spontaneous abortion in the context of exposed women was 21%, which is in contrast to what we have with these products, which is more than twice. So actually, I thought that was quite staggering, and I don't know, maybe I'm gonna write something about that. I'm gonna leave this alone because Josh Getsko is gonna talk all about this, I'm sure. This is just about bad denominators and Israeli data. Eek. There's another study that came out of Canada. The authors claimed that the COVID-19 mRNA vaccines are perfectly safe. Yet, in their own publication, they have this quoted: pregnant, vaccinated females had an increased odds of a significant health event within 7 days of the vaccine, blah, blah, blah. So, I don't know, there are many contradictions there. Watch this movie. Watch this interview. Dr. Luke McClendon from Australia, amazing guy. I watched from beginning to end, really, watch it. And I don't want to leave the males out, but then I'm going to finish up because this paper is very important and it was highly censored. It was published in Andrology this year. It showed that semen concentration and total motile count was impaired. And of course, they used the word temporary, just like they used the word temporary with myocarditis. So sorry, I'm not buying it. Same thing in VAERS. If you pull out just a few keywords involving male sexual health reports, you get the same kind of profile. Not as bad looking as the female, but we're still early in the data. And again, if you incorporate the underreporting factor, the rate becomes 1 in 686. Oh yeah, you know, I don't have to read that out, but it doesn't sound really fun for men. Again, if you look at the past 5 years of data, the story isn't as obvious as it is for the females, but we still have 1.4 times higher reporting of these problems in the context of the COVID products. So the take-home message for me, even for people who don't want to buy a word that I'm saying or reporting on, because I'm not really saying anything, the risk-benefit analysis that you have to do is so simple. The risk from the shots is death, and it seems like your susceptibility to COVID goes up wacko nut bar job high if you do get an injection or 2 or 3. It seems to go up incrementally, as a matter of fact. And if you're pregnant, it seems to increase the risk of spontaneous abortion. So it doesn't seem like the scale is balanced there in terms of the risk. Nobody needs these shots, in my opinion. We don't have any long-term safety data even now. We're collecting it. That's why I started with saying that we're in an experiment now. We're collecting the data. The peer-reviewed literature is painting a picture with the words precautionary principle all over it. Children don't need these shots. They never did. And I would never recommend taking the risk. So that's all I'm going to say for now. I hope I was all right and I didn't talk too fast. That's my new Substack newsletter, and that's my website where you can find VAERS updates. So thanks.
Thank you, Jessica. Pierre Kory, please.
So I'm going to start by saying that 2.5 years ago, I worked leading a major intensive care unit. I was publishing, doing research, teaching. I read the New York Times every day. I was fully vaccinated. My children were fully vaccinated. I believed what I read in the medical journals, that they represented the best of science and only the best papers, the most accurate papers showed up there. And here I am 2.5 years later, and I'm not going to say I'm broken, but that whole reality I found out was completely false. And the way in which that journey went is that I became very interested as a physician in COVID and trying to figure it out with some colleagues. We read papers, we followed all the studies and data on therapeutics, we talked to doctors around the world, and little by slowly we put together protocols on how to treat COVID. And during that time, about 8 months after we started, we discovered that there was a medication called ivermectin, which was showing incredible efficacy in a number of different sources of data. And we understood that it was effective. We started using it. We wrote a paper. And so I'm bringing up ivermectin in the context of the vaccines because what I learned after becoming an expert, and I didn't know what we really were, I knew we were becoming an expert at a drug. I didn't understand that we were striking at the heart of the pharmaceutical industry. And by learning about that drug, I got to see, like what was revealed to me in these last 2.5 years is the decades of control and techniques that the pharmaceutical industry has to corrupt science. And I will tell you that science is horrifically corrupted. I would have never believed the things that I've seen. I saw it around ivermectin first, and that's where sort of my reality started to change, because after we started talking about ivermectin, nothing happened the way it should have happened. Things started to get really bad, and I started to see lies everywhere. I saw it from the best newspapers, the best magazines, from the mouths of the best scientists out of the agencies, and they were all lies. And I couldn't figure out what was going on. And pretty soon I realized that what happened is that ivermectin is a generic drug. It's off patent, and had the world known of its efficacy, it would have destroyed everything. It would have destroyed the entire vaccine campaign, because very few people would have taken a vaccine. If you were offered a safe, available pill, you would have taken that rather than an experimental vaccine. It would have destroyed the markets for everything that the pharmaceutical company is trying to sell in COVID, whether it be antibodies, remdesivir. And then I learned about the history of the pharmaceutical industry. So 2 things about that industry. Number 1 is that it's a documented criminal industry. Number two, its entire business model rests on destroying what are called repurposed or generic drugs. And so when I became an expert at a drug, I just thought that our expertise would be, well, I don't know if there was going to be a ticker tape parade, but I did think people would be appreciative of our expertise, and we got attacked, and the medication got attacked, and the ways in which it got attacked, it led me to know a few things. I started to understand what propaganda is. I started to understand what narratives were. Within months, I could no longer read the New York Times because I saw every single thing was a narrative. When I say everything, maybe if it's fashion or music, no, but anything with political dimensions was clearly a narrative. And once you start to see narratives and propaganda, you can recognize them. And then I saw the same thing happen with the vaccines. And basically what I want to sort of talk about briefly in whatever minutes I have left is that my most recent focus is that the foundation of all of the lies, all of the propaganda, all of the fraud, I believe the foundation starts with the medical journals. And when I say the medical journals, I mean specifically the high impact medical journals. And there's journals are ranked by something called an impact factor. If you Google it, you will find that the top 5 or 6 in the world are the New England Journal of Medicine, the British Medical Journal, the Lancet, the Journal of American Medical Association, and then I'm going to add the Cochrane Library, because the Cochrane Library is considered the premier journal that does what's called the strongest level of medical evidence, which is a summary analysis of trials. Okay, why am I talking about those journals? It's because everything comes from them. And I thought that good papers of well-designed trials would get published. And what I discovered around ivermectin, and there's a lot of evidence around the vaccines, is if you look back to the beginning of the pandemic, right? So when this started, scientists very quickly started to look at the genetic sequence of this virus. And what was the first thought that they had that something might be wrong here is that they were being told a story that there was a wet market a couple of 100 yards away from one of the only labs in the world doing gain of function on coronaviruses, but yet it came out of the wet market, right? Remember that story that this was a bat origin or came from animals? And you have to see what happened next, right? So within a month, papers were published in prestigious journals telling the world's doctors and scientists that indeed, no, this did not come from a lab, right? So they tried to cover that up, but they did it with published papers. And there's a documentary which goes over the origins of this virus, which we know came out of the lab. It's a man-made virus. You could never get something this toxic this quickly. And then you could see in that first documentary, world-renowned scientists who had long published in many top journals throughout their career, they couldn't get their papers accepted. They had definitive proof that this was a man-made virus, and yet they couldn't publish it, right? So the two things I want to leave you with is that there's propaganda and censorship, but none of that propaganda or censorship could happen unless you have the science to support it. And what I discovered is that in these last 2.5 years, what appears in those journals is what they allow to appear in those journals. And I have firsthand knowledge, becoming an expert at ivermectin, meeting Dr. Tess Laurie over there, and she and I have worked, across the pond on different parts of this fraud. But seeing what's happened to her career and my career, and we have direct knowledge of many investigators of ivermectin who cannot publish their papers. They were consistently rejected from all the high-impact journals. And then what do you see show up in high-impact journals? These supposedly rigorous large trials, which don't show a statistically significant benefit, and then you see a parade of propaganda emanating. So they'll publish the paper one morning. I've had about 5 of these mornings in the last year, and I'm so tired of them. But you'll wake up, and the New England Journal published a paper showing that ivermectin doesn't work, and then you see masses of headlines. And I think this is about vaccines, right? I'm using ivermectin as an example, but I want to bring that to the vaccines as well. Is in my journey in studying the vaccines, because of what I learned around ivermectin, I saw the same tactics. We knew the data on the ground coming out of the more transparent health ministries was showing that these things were deadly and they weren't working, and the hospitals were filling with the vaccinated. Yet you saw narratives being propagated from journal articles showing they are safe. You're seeing these absurd statements of their safety in pregnancy. Everyone was being reassured through published journals in high-impact journals that these were safe and they were working. And as the data that was not coming out of those journals was becoming overwhelming, they had to start changing. But we've known for a lot longer than now how ineffective. I mean, this vaccine program has failed. It needs to be stopped worldwide. It should absolutely be stopped immediately. We're seeing, Jessica didn't bring it up, but we're starting to see these abrupt drops in birth rates 9 months after the peak rollouts of these vaccines. I mean, that's the science. We're starting to see that showing up in birth rates. And so what I want to say is, I know what the corruption is now. We've seen, so the two things that they've done, there's 4 tactics. And by the way, what I'm describing